My name is John Snedeker. I'm the clinical director and co-founder of LaSara Medical Group here in Southern California. And I'm really excited to share this video with you of one of our patients named Larry, who's a prostate cancer survivor. Larry began to experience erectile dysfunction after going through radiation treatment of the cancer, and his doctors told him that you would never be able to experience erection ever again. The good news is Larry has gone through LaSara Medical Group's shockwave treatment, and as a result, he's been able to reacquire a sex life again. So here's his story.
My name is Larry, and I am a patient at LaSara Medical Center. And John has asked me to share a little bit of my experience, which I'm happy to do, and hope that this may be beneficial to someone else who may have a similar medical background as to myself. I was diagnosed with prostate cancer 8 years ago, and after reviewing my medical treatment options, I elected for a radical prostatectomy using robotic surgery. And I did so deliberately. I felt that would give me the very best possible outcomes toward the two issues I was most concerned with, which were incontinence and impotence. As robotic surgery had very good results with nerve-sparing surgery. Well, the surgery went very well, and indeed I could tell I was recovering just fabulously following surgery. However, I went into my post-op visit with my doctor and got the pathology report, which was something no one had anticipated. They had failed to achieve a positive margin at the bladder neck, and that meant cancer cells were still in my body. Well, what to do? That began a series of visiting, frankly, nationally, oncologists, and listening to some very grim prognosis. I was very fortunate to meet with the head of Hoag's Hospital's oncology department, who had ideas, but they involved a follow-up radiology treatment. And as I was meeting with the head of radiation oncology at Hoag Hospital, this was an older doctor, I expressed my concerns that I had done what I had done, in the effort to spare my nerves for, the nerves around that encapsulate the prostate. And I was concerned what radiation might do in that situation. And he said, "Oh, don't worry, you will be impotent following treatment." And I was devastated. And he said, we're going to be irradiating the pelvic floor, and they're right in the middle, and they're exposed, and they're vulnerable, and they are, frankly, they're in a state of stress following surgery. He said, there's absolutely nothing that can be done. Well, I shared this news with my personal oncologist, who said, "You're at risk. You're at extreme risk, but we will do what we can." And that's kind of been my story, is that it's about doing what I can. So following the radiation treatment, and I should share with you that I went through a full round of radiation treatment. It would have been the same treatment had that been my original treatment protocol. And at the conclusion of it, I went to my doctor. I said, "Gee, I don't feel that bad." And he said, "Larry, the bad news is that we just raised the toxicity in your body to a level at the very conclusion of treatment." He said, "It's really this point forward that you're going to notice the effects of radiation." And prophetic words, because for the next year, I was nauseous, I was sick, I had diarrhea. There was literally no sex life whatsoever. Even though I was blessed with a very patient and caring and understanding woman for a wife, it was a disaster for the first year. After that, I started having some response to Levitra, Cialis, etc., but it was hit or miss, just not consistent at all. And time went by. Gradually, I would get a little better. Meds would work intermittently, and time went on. I think that I was getting a little better incrementally as we went forward, but still, it was far from a satisfactory outcome, and years are going by. And I just felt this was a big part of my life that was missing, that I wanted desperately to get back. I read everything that I could lay my hands on, investigated all sorts of things, and came across LaSara and spoke with John, the clinical director at LaSara. And you know, it seemed like something that was worth a shot. Certainly, we couldn't be certain that this was going to be 100% effective, but I was, frankly, would have been satisfied with improvement. So I've just finished my second round of treatments, and I can tell you that there's been a change. I'd have to say it's a change for the positive. Two things. Number one, the meds are, I was taking 40 milligrams of Levitra. I'm now down to 20 and having excellent, consistent results. I couldn't have said that before. And then we have things, and just to be candid, I have what we call spontaneous erections, which did not happen before. You know, I've got to say that I'm optimistic. I think that you know, it's better and continues to improve. And John has indicated that this is really the beginning of the protocol. I mean, it's really at this point and for the next 3 months is really when I should start to see results. And I've told him that if we see improvement, that I'd be back in 3 months and I'll do a follow-up for him. But I really applaud his, I believe he's utterly sincere in his desire to assist men with this. You know, this is really personal for us. You know it and I know it, okay? This is very core to who we are. You know, our ability to express ourselves sexually. And even though I am, you know, I will be 67 years old this Sunday, okay, you know, inside I am who I am, and I don't feel like I'm old, that the best years of my life are still ahead of me. So this is a big part of my life, and I want to thank John for giving me the opportunity to make a shot at, giving this a shot, and I want to thank you.
For the other men out there that are experiencing erectile dysfunction as a result of prostate cancer and the subsequent treatment you must go through, I encourage you to reach out to us and ask us your questions. Shockwave therapy is a great tool to rehabilitate the erectile tissue and help you regain your sex life. Visit our website at LaSara.com or give us a call, and again, we'd be more than happy to take care of you.